Hi everyone, I'm Christina Fecio and I have an opportunity to catch up today with Kristen Kerr, who is the Executive Director of the New York Association for the Education of Young Children. Many of you are familiar with Kristen. She has a great relationship with us here in Western New York, but I'm really happy that you had an opportunity to free up a little time in your schedule. So thank you very much. I appreciate that.
Thanks for the opportunity.
Yeah, we're happy to have you. I'd really like to turn it over to you, Kristen, to just share a little bit about some of the advocacy work that you've been doing to mitigate the impact of the COVID-19 crisis, but then hopefully also to share a few strategies that providers here in Western New York might be able to act on to support those advocacy efforts.
Sure. So first, I think it's important to say that we do a lot of our advocacy work in collaboration with many organizations and state partners. And we participate both in the Winning Beginning New York Coalition and the Empire State Campaign for Childcare, which I'm sure many folks are familiar with. And so we have really been working to, from New York AEYC's perspective, as an individual membership organization that represents early childhood educators, really trying to think about both the impact on the individual educators as well as the programs and the childcare industry, if you will, as a whole. And so our work around the industry has really been focused on how do we secure public funding and the support of key policymakers in really thinking about how we support childcare as we move back into reopening New York State and really recovering from this pandemic. I think it's fair to say that none of us, not us as an organization or individual programs or government at really any level was prepared to respond immediately to this pandemic. And so we've essentially been building the plane and flying it at the same time. And I know that's true for early childhood educators as well. And so I think, there are things that have happened, and I want to make sure that people know about that. We worked very hard to make sure that childcare providers and programs knew that they were eligible, for example, to participate in the payroll protection program, which was a small business loan available across the country. Many people are probably familiar with the fact that it ran out of money the first time around. There was additional funds put in. Right now, we're working to assess how many programs in the state did actually apply successfully. Also, the federal government in the CARES Act included an additional $3.5 billion for the Child Care Development Block Grant, which people in the state may know as the Child Care Development Fund. It is one of the primary funding streams for childcare, and so that was that meant an additional $164 million for New York State. And so we worked with, again, our partners in the state to advocate for making sure that that money was used both to support programs, but also to support families, in particular, the families of essential workers, to have access and support for childcare in difficult times. So there is currently a CARES scholarship program that I hope people are familiar with and encouraging families to apply for. And so now our work is really focused on making sure that we implement policies that will help us leverage that $130 million remaining money to support programs either in remaining open or being able to reopen. And so that is something that we continue to focus on, is really how do we ensure that those funds are used not only to ensure that families have access to childcare, but that there is childcare still available for when families need it as they return to work. And so I think sort of on the horizon is we anticipate that Congress will take up yet another COVID-19 bill, and that there will be an opportunity to advocate for additional federal funding, again, which would mean additional money for New York State. And so I think it's, you know, for us at NYAEYC, it's really about how do we collect the information that helps policymakers make good decisions about how they use the funding that we have available, and also help to demonstrate the additional need, what additional resources, both in the way of money and policy changes, do we need to use that funding more effectively. And so one of the things that we have done is we conducted a survey sort of at the beginning of the New York pause, which happened in the middle of March, as we all are acutely aware of, to really find out what was happening in programs. We had about 450 programs respond, telling us sort of what the status was. Were they open? Were they closed? What was their enrollment like? You know, what were the biggest challenges they were facing? And so we're doing a follow-up survey to dig a little bit deeper and see where programs are now. So that's sort of the data piece in terms of what we're trying to collect. But then in addition to that, we're trying to collect stories from the individual providers and programs to help us illustrate what the data we're collecting means in terms of real lives on the ground. You know, how many families is it going to affect if a program closes? How many employers is it going to affect if those families lose access to childcare? And so I think one of the other things that we work to do is to elevate the voice of the programs and the providers and tell those stories so that it helps really illuminate the impact of this data that we're trying to share with the policymakers and decision makers. And so it's very important that they not only hear from those of us who sort of live and work and spend a lot of time in Albany and hanging around the state capitol and having conversations with policymakers, but that those policymakers, legislators, Congress members hear from their constituents. You know, the childcare providers that are providing these essential services during this, you know, unspeakable pandemic, really putting their own health and well-being on the line to ensure that the families that need it have access to their services, but also to help those policymakers understand what would happen if they were not able to continue to do this work because they financially can't afford to. So, you know, I think there are a number of things that you know, we at the state level can do, but we really need to find a way to connect to those voices on the ground and then make sure that our policymakers hear from those who are living this every single day and really understand what the impact is, not only on their programs, but on the families they're serving.
So when you think about that opportunity or that necessity for providers to share their stories, do you have a suggestion on how to connect providers with organizations like NYAEYC, like specific ways that those stories can be told? Is that a letter to the editor? Is it an email to you? Like, how might that look?
Sure, I think yes, and all of those things. So I think, you know, we would like to be a resource to those who would like to do some sort of advocacy work. And so you can reach me, or you can reach Katie Albitz, who's our public policy coordinator, through our website. Our contact information is there, and we're always happy to connect with people. But we're also, as I said, conducting an additional survey. And one of the things that we're doing is asking people to share their stories in that survey and provide us with contact information so that we can reach out to you directly and really help you then share your story with the appropriate representative, or perhaps crafting a letter to the editor in your local paper using that story. You know, and people also don't necessarily need to come through us. They can certainly reach out and directly contact their representatives in Congress or in the state Senate or Assembly, and simply share their story. And I think one of my suggestions would be that, you know, really illustrating how, if your program were to close, it would impact your community by, again, sharing how many families you serve, how many employers those families work for in your community. You know, and I know things are a little bit different than they will be, hopefully, when we are fully reopened and able to function, at least in some sort of new sense of normal. But it's going to be critical that families have access to childcare in order for New York to be successful in reopening and essentially getting back to business. So we want to make sure that we're doing everything we can, both to support programs and educators as they go through this, but also working to ensure that programs have what they need going into the future, and really thinking about how we, you know, we fund a system that creates equity for families, ensures that programs have financial stability, and that we are making sure that educators are fairly compensated. And so I think while people were aware of how fragile the childcare system was before this pandemic happened, I think this pandemic has really sort of ripped the curtain away and exposed exactly how fragile the business sort of model of childcare is. You know, we function at a very narrow margin, and this pandemic has exploited that pretty significantly.
Yeah, absolutely. You know, you can't escape headlines talking about the essential nature of this work, and it's something we've known all along, obviously.
Right.
So I appreciate the suggestions that you offered. I did have a question about the survey. Is that something that's active now, or is it something that's getting pushed out via email?
It is something that will be pushed out via email. And so, you know, if people don't necessarily receive that, they can certainly reach out to us and we will make sure to send it to them. It will be fairly broadly distributed, but, you know, we would love to have more than 450 respondents. We were pretty pleased with that when we had that, but obviously that's a small percentage of the programs in New York State. And so the more data we can collect, the better. So if people don't receive it, I anticipate that it'll go out tomorrow. We're actually just finalizing it now in our Advocacy Matters, which is a once a month newsletter that we send out pretty broadly.
Okay, so once I receive it, then it's fine for me to share it out to the folks that I work with. Okay, great.
Absolutely.
Great. Mm-hmm. All right. Well, I appreciate you taking the time to talk with me today. Is there anything else you'd like to add? Maybe just if someone were to take away one key recommendation from the information you've shared, something that you would suggest?
I think, you know, I think the key recommendation is that we know there's a lot going on, but that it's very, very important that policymakers and key decision makers hear from early childhood educators and administrators, that they find a way to share their story. And again, I encourage people to reach out to us. We are happy to help in any way that we can, because we know it's a big ask and a big lift right now, given everything else that is happening, but it's critically important that people are sharing their stories. And if I could, I just want to offer one other thing that New York AEYC is doing. We have a shared services platform that we administer and is usually exclusively available to our members, but we have opened that up to all licensed and registered programs in the state of New York. It provides lots of resources, including specific to COVID-19, shared purchasing so that you can receive discounts, and we just wanted to make that available. So I just wanted to make note of that too.
Yeah, that's great to know. Shared source is one of my favorite resources. I always describe it to people as like the benefit of the best benefit of being a member. So the fact that right now people could be introduced to it is great. So I'll make sure to add a link to that when we wrap up the conversation. But thank you so much, Kristen. I appreciate you sharing your insight. I know too that you're really busy. So I appreciate you taking the time to help support providers in Western New York too.
Well, and we appreciate everything they're doing and that you're doing in Western New York. It's going to take all of us to figure out our way through this. So just thank you to everyone who is so committed to the children and families of New York. I really appreciate it.
Well, the feeling is mutual. So thank you again.
All right.